Well, it's been a few weeks since the last video I made, and like I told you, I was doing carpal tunnel on both hands. So this is the right side, which I had on the 5th of February, so it's been 21 days, 3 weeks. I still have some significant, well, it's not really significant, it's a lot of pain when I do stuff like that, and I can't put any weight on it, that like doing a push-up or something, that's impossible. So anyway, last night, or yesterday, I went and had the left side done. And if you look at the old videos, it's similar markings on my hand, you know, yes, to make sure that they got the right hand, and there is a cut here and a cut here. Now I think by looking at it that he cut significantly more in the palm of this hand than he did on this hand. I can't really feel anything right now. I can move my fingers. I can't put my pinky and my thumb together. So I learned a little bit more about carpal tunnel release surgery since the first one I had, and I talked to the doctor about the pain that I'm having here, which sometimes is referred to as pillar pain, which is the pain on both sides of the incision, and that takes anywhere from 3 to 6 weeks to get down to the point where you can get full well, I guess 6 weeks, probably 6 weeks to get a lot more use out of it. After 12 weeks, from what I understand, there are very few people who continue to have pain down the sides of the incision, and after a year, almost nobody. I did find a few blogs on the internet where people were basically disabled based on the surgery. One of them was a dental tech or a dental hygienist, and she couldn't hold her tools anymore after she had the surgery. Which is kind of strange because the doctor had told me that if you don't have the surgery, then you're going to lose grip strength. This is the muscle that they say would go into atrophy with carpal tunnel syndrome if you don't get it fixed quickly. So this muscle goes away, and then you don't have any grip strength left if you don't get carpal tunnel treated. So it's kind of strange that on the other side, the extreme on the other side is that the negative side effects of the carpal tunnel release surgery could be that you lose grip strength. So you don't get it done, you lose grip strength. You get it done, and you're that 0.01% that loses grip strength. So for this one, when I was asking him about this pain, he explained to me that even though the incision mark is here and here, he goes all the way up to here, and he goes all the way down to here inside my arm, cutting. I guess there's a lot of cutting going on here. So he said it doesn't surprise him that I can't do push-ups, and he advised me not to try to do push-ups, at least for another 3 to 6 weeks. For this one, because I have both of them, he's looking at 4 months full recovery. So I hope it doesn't take that long. But I also bought a rubber band, like at a Play It Again Sports, where you can pull this way and this way and this way. And if I do my next update, I'll show you what I bought. But I'm trying to aggressively exercise it just because I've got to do pull-ups, I've got to do push-ups, I've got to do that kind of stuff being in the military. So just showing the surgery. I don't know how close you can get here or how close you want to get, but it looks like it was cut here all the way up to that section. So if you're planning on having the surgery, I don't have any pain today. If I try to grab, I have pain, or if I move my hand too much, I have pain. But just sitting here, there's no throbbing pain, there's no incision pain. I am on hydrocodone 7.5 milligrams. I think it's 7.5, 500. So I'm, kind of dopey. If I stand still, I will fall asleep. Or if I'm sitting still without moving around, I'll fall asleep. So this is update number 1 for surgery number 2. check back in with me in a day or so, and I'll post another update. Hope everything's going okay. Prior to this, or after I got out of this surgery, I was at 205. So weight-wise, the last two surgeries, the nose and this one, I gained 10 pounds, and it got me back up to 209, 210, and then it took me 2 weeks to get back down to 200. I came out of the surgery at 205. So my goal, now that we are 2 days away from March, and I have 30 days to get down to 185, like I said, if I hold myself to that goal, I should be somewhere between 195 and 197. Now that all surgeries are complete, I'm going to make a push towards that 185. I have 30 days to do it, and 32 days to do it, and I don't intend on letting you down. Hold me accountable, but if I fall slightly short of it, at least I tried, but I'm not planning on it. Okay? Well, have a good week. Today is Wednesday, and it's always the favorite day of the week. Okay.